All right, and then jumping into our topic for today, we're going to be talking about decisions about work. So that includes your rights while you're working, taking time off work, and options for replacing lost income. If you have questions during the presentation, you can type them into the Q&A box, and one of my colleagues will be there to answer those questions. We are proud to offer this series in partnership with the Los Angeles Public Library. And then just a reminder, Triage Health is a program of the organization Triage Cancer, and Triage Health provides free education on legal and practical issues that to help people navigate healthcare issues through resources, materials, and events. This can be especially important when someone's navigating a chronic or serious medical condition. However, many of these issues, like employment, can impact everyone, whether you have a serious medical condition or not. And we provide this education through a variety of resources, including quick guides, animated videos, and webinars. As a quick overview of today's webinar, we'll start by discussing your options while you are working, followed by options if you need to take time off of work, if you need disability insurance, and how your decisions about work may impact your health insurance, and how all of the laws in these areas can work together. Now, when we're talking about employment rights, there's actually lots of places for you to go. There are laws that we call fair employment laws that protect people against discrimination in the workplace based on their medical condition and give them access to reasonable accommodation, which is something we'll talk about more in just a moment. These laws exist at the federal level, like the Americans with Disabilities Act, but they also exist at the state level. There are also laws that we call leave laws that allow you to take time off work and provide some job protection and sometimes even health insurance protection. Again, these laws exist at the federal level, like the Family and Medical Leave Act, as well as the state level, and sometimes even the county or city level. And then we sometimes forget that we work under an employment contract. So for example, if you're a member of a union, your union bargaining agreement is actually going to provide some additional information about whether or not certain benefits would apply to you. And sometimes we forget that the law just provides the bare minimum of what employers have to do. There are many employers that go above and beyond that bare minimum that the law requires. So you would need to look specifically at your employer's policies to find out what you might have access to. This can include things like employee benefits, whether or not you get health insurance or disability insurance or life insurance through your employer. Do you have access to specific sick time or vacation time or other types of leave? Can your coworkers donate hours to you? These are all types of policies that are going to be specific to your employer, and they can usually be found in some version of an employee handbook or an employee manual. Now, when we're talking about fair employment rights, we're often talking about the Americans with Disabilities Act, or the ADA. The ADA is a federal law that prohibits discrimination against people with disabilities in several ways, including in the workplace. Most people are familiar with the ADA in the way that it requires accessible parking spots or accessible bathrooms or ramps into public buildings. But there is a section of the ADA that just focuses on employment called Title I. Title I of the ADA is enforced by the Federal Equal Employment Opportunity Commission, or the EEOC. And many people who are diagnosed with a serious medical condition may not consider themselves as having a disability, so they may not think that they're protected under the ADA. But this is a situation where I really encourage people not to get caught up in labels, because otherwise you might be missing out on protections that are available to you. But not everyone is going to be eligible for protection under the ADA. There are a few hurdles that you need to clear. First, An employee has to work for a private employer with 15 or more employees or for state or local government. And if you're a federal employee, you're likely to be covered instead under the Rehabilitation Act of 1973, which has very similar protections to the ADA in the employment context. In addition to working for the right-sized employer, you also have to be a qualified individual. Legally, that means an individual who can perform the essential functions of the job with or without a reasonable accommodation. Practically, what that means is that you're qualified for the job and you can perform the key responsibilities. But you can get help to do that through an accommodation, which we'll talk more about in just a moment. And then the last hurdle to clear is that you have a disability within the ADA's definition of disability. Under the ADA, a disability is a physical or mental impairment that substantially limits a major life activity. So let's break that definition down. First, you must have a physical or mental impairment. Second, it has to limit a major life activity. And third, that limitation has to be substantial. It can't be something minor. It can't be something that happens once in a while, but it has to have a substantial impact on a major life activity. So what's a major life activity? It's anything that the average person in the general population can perform with little or no difficulty. Major life activities are things like breathing, sleeping, walking, talking, eating, concentrating, the operation of major bodily functions. These are all things that can be considered major life activities. And it's not necessarily a person's diagnosis itself that creates the disability, but it might be the side effects from a treatment or symptoms of the diagnosis, like nausea, fatigue, or anxiety. And these are the things that are impacting your major life activities. It could be that you have one extremely significant side effect, or it could be that you're experiencing a combination of side effects that together create the presence of a disability under the ADA. So when we're looking to see if someone has a disability under this definition, we look at it on a case-by-case basis, meaning we look specifically at the person and how their medical condition is affecting them. In other words, we can't classify all people with a particular diagnosis as having a disability. Once you've shown that you are qualified and that you have a disability under the ADA's definition, there are 4 ways that someone can actually use the ADA's protections. The first is that you currently have a physical or mental impairment that substantially limits a major life activity. The second is that you have a history of having that impairment. So, for example, if you're a 5-year cancer survivor with no current symptoms, you're not in active treatment, and you're not being substantially impacted, but your employer is treating you differently because you have that history of a cancer diagnosis, that is enough for protection under the ADA. The third way isn't really about you, but it's about your employer's perception of you. So this is where your employer is regarding you as having a disability and treating you differently because of that belief. So for example, if you lost your hair following chemo, but you're now otherwise ready and able to work, but your employer assumes that you're not able to work, even though you might not be substantially limited in any way, this is still enough for protection under the ADA. And then the fourth way that you can be protected is based on an association with the person with the disability. This is where caregivers might be able to get protection from discrimination under the ADA because they associate with a person with a disability. They might be treated differently because of an employer's perception, maybe that the caregiver is going to be distracted, or maybe they're not going to promote a caregiver because the employer thinks that the caregiver won't want additional workload. These are circumstances where an employer cannot discriminate against a caregiver for associating with the person who they're caring for. So the bottom line, really, of the ADA's employment protections is that an employer cannot take into consideration someone's medical condition. Now, the ADA applies to all phases of the employment process, which means it doesn't just provide protections when you are an employee, but it provides protections when you're a job applicant. So before you even get the job, you're entitled to protection under the ADA. So what does the ADA actually do for you? In all of these circumstances, the ADA protects you against discrimination in the workplace. But if you currently have a disability or you have a history of having a disability, in addition to being protected from discrimination, you may also be entitled to reasonable accommodations. The legal definition of a reasonable accommodation is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Now, since that definition is not very clear, we find that the best way to talk about reasonable accommodations is to use examples. On a practical level, a reasonable accommodation could be almost anything. And they typically fall into one of three groups. The first group is about the physical workspace. So this might mean moving offices or getting special equipment or furniture for your office. Maybe you need a closer parking spot to the office, or maybe you need a desk closer to the restroom. It could also mean telecommuting, which might mean working from home, but it also might mean working from another location than where you would normally work. So for example, maybe you have a weekly dialysis appointment and you want to work on that day from the dialysis center. That could be a reasonable accommodation that you receive from your employer. The second category is a change in schedule. And there are different ways to change a schedule as a reasonable accommodation. So it could be about adjusting your hours or changing your shift. It could be about having a flexible schedule or adding additional breaks. It could also be about extending leave, which is something we'll come back to when we talk more about leave in a little bit. And then that last bucket is everything else. So maybe it's about using technology. So if we have someone who's dealing with neuropathy in their hands and they're supposed to type all day for work, maybe they could get a speak-to-type software to help them do their job. Maybe it's about a policy. So if we have someone who works in an environment where there's a strict dress code, but they need to be able to wear a coat or a hat because they're experiencing temperature sensitivity, there could be a change in the policy to allow them to enjoy equal employment opportunities. It might also be about shifting responsibilities. So for a school teacher who's also asked to do the drop-off line in the morning and recess duty, but that school teacher is feeling fatigued due to her medical condition, maybe that drop-off line and recess duty could get shifted to another employee so that that teacher can rest during those periods. And finally, it could mean a job change entirely. Now, this is something we call the accommodation of last resort because there are some downsides to this particular accommodation, and employers do not have to create a job for you. It's only available if there's a vacant position and you are qualified for that position. When we're talking about reasonable accommodations, there are some practical pieces to consider. Sometimes we hear from people things like, my employer's been really helpful and really supportive, and I just hate to ask for one more thing. But it's important to remember that what you're asking for is not a favor. The reality is that employers are required to provide eligible employees with reasonable accommodations unless they can show that it's an undue hardship or a direct threat, which are pretty high bars for employers to meet. That being said, the accommodation does have to be reasonable. And what's considered reasonable is going to be very specific to your job, your employer, and your needs. What might be reasonable for one employee may not be reasonable for somebody else. For example, a bus driver probably isn't going to be able to telecommute for their bus route. So the reasonable accommodation does have to make sense based on your job responsibilities. Now, as I mentioned earlier, people who are caregivers are not entitled to reasonable accommodations under the law. But it sometimes falls into this category where it doesn't hurt to ask, because many times employers want to keep their valued employees, even if that means the employee is the caregiver and not the one with the medical condition. Now, asking about reasonable accommodations brings up a number of practical questions of how you actually go about doing that. You should always ask for an accommodation as soon as you realize that you need one. Because if you don't, and you wait to ask until whatever you're coping with has started to affect your performance, then your employer might make decisions like demotions based on your job performance. So how do you ask? You don't have to specifically say, I'm using the ADA, or I use the words reasonable accommodation in order for your employer to be required to provide the accommodation. An employer should really understand what it is that you're asking for. But unfortunately, we often see employees being in the position of educating their employers. So I want to mention this valuable resource called the Job Accommodation Network, or JAN. JAN is funded by the U.S. Department of Labor, and their mission is to help employers and employees navigate reasonable accommodations and help them have these discussions to help ensure that employees are getting the accommodations that they need. When it comes to asking for the accommodation, you can ask the person at work that you feel most comfortable in asking, but I would recommend that you look at your employee manual to see if there is a process laid out by your employer to make those requests. Now, one of the great things about reasonable accommodations is that they're pretty flexible. So it might be that you need more than one accommodation to deal with everything that you're coping with. So you don't need to find just one thing to make everything better, because you can get more than one. Also, your need for an accommodation might change over time. So what someone needs after surgery, for example, is going to be very different than what they might need after starting a new medication. And your accommodation at work can be adjusted to meet your changing needs. So in summary, when we think about accommodations, these are some of the helpful questions to ask yourself. First, what is the thing that is challenging? Are you experiencing a particular side effect or symptom that's causing the challenge? How is it a challenge at work? So in what way is that challenge affecting your ability to do your job? And then you might need to get creative and thinking about things that might make it better. So maybe you need to telecommute, maybe you need technology in order to do your job with an accommodation. And then you want to request that accommodation. And once you get it, we recommend getting it in writing. This can be especially helpful in making sure you continue to get an accommodation that you need, even with, for example, changing supervisors. Now, to help put that all into context, we're going to go through Jerry here as an example. And while I'm reading through this, I'd like you to think of what types of reasonable accommodations might be helpful for Jerry. And then we're going to talk about what some of those may be. So Jerry has been diagnosed with cancer, and he's been receiving chemotherapy treatment. He's worked through his treatment, but he has been experiencing chemo brain, including a loss of focus and short-term memory challenges. He's concerned it's affecting his ability to work. Jerry works for an internet company, and his desk is on a floor of the building where all the desks are in an open floor plan with offices circling the open floor plan. There are 2 desks per cubicle and low partitions between the cubicles, but Jerry finds it difficult to concentrate at work. So what are some things that might be helpful to Jerry in his job? So first, if we think about the workspace, maybe Jerry could request to have an office with a closed door or a single desk and a cubicle rather than sharing it. Maybe he wants a higher partition between the cubicles, or maybe it would be helpful to move his desk to the corner of the office rather than in the middle of the workspace. Jerry may also consider something like telecommuting. Maybe it would be easier if you were working from home. If we think about changing schedule, we might consider if maybe Jerry wants to work from 7 a.m. to 3 p.m. so that the office is maybe a little bit quieter when he's working at sometimes. Maybe he wants to request technology like noise canceling headphones to help him be able to concentrate in the workplace. In summary, there are a number of things that might be able to help Jerry be able to do his job to the best of his ability. Now, in addition to the ADA, California has its own state fair employment law as well. California's law can be more protective than the ADA since it has a broader definition of disability. It also lists certain diagnoses as being potential disabilities like cancer, diabetes, epilepsy, clinical depression, as well as a number of other diagnoses. And the California Fair Employment Law covers employers with 5 or more employees instead of 15 like the ADA. So this can help more people qualify for protection under the California law. Now, if someone needs to take time off of work, they have a few different options. And those options may vary based on if the person taking time off work is the person with the medical condition or if it is a caregiver. For employees who need to take time off of work due to a medical condition or caregiving responsibilities, this is where the Family and Medical Leave Act, or the FMLA, can come into place. The FMLA is a federal law that's enforced by the U.S. Department of Labor's Wage and Hour Division. And it allows eligible employees to take time off for their own serious medical condition or to take care of a child, a parent, or a spouse with a serious medical condition. Now, this is a pretty narrow definition of family members that you're allowed to care for under the FMLA. It's only a spouse, a parent, or a child. So people, unfortunately, are not entitled to take time off for care for a grandparent or a sibling or an aunt, etc. There are requirements that must be met to be eligible to use the FMLA's benefits. Under the FMLA, an employee must work for a public employer of any size or a private employer with 50 or more employees. But it's 50 or more employees within a 75-mile radius of the employee's work site. So this means that if you work for an employer with multiple offices within 75 miles, the employee can add up the number of employees at each office to reach that 50 employee mark. Additionally, employees also have to work for their employer for a long enough period of time. Sorry about that. So the FMLA requires that employees work for their employer for at least 12 months, and then employees must have worked at least 1,250 hours during the last 12 months that they worked for that employer, which comes out to about 24 hours a week if the employee works all 52 weeks in a year. It's important to note here that the 12-month requirement can be a little bit flexible because the 12 months don't need to be consecutive, only cumulative. So the FMLA allows employees to go back 7 years in their work history to meet that 12-month requirement. So for example, if you work for an employer for 5 months and then you leave, and 3 years later you go back and work for that same employer again, after 7 months, you would be able to take the FMLA leave as long as you also met the hour requirement, because you'd be getting credit for that previous 5 months that you worked for that employer. So what does the FMLA actually do for you? The FMLA entitles an eligible employee to up to a total of 12 weeks of unpaid leave per year to deal with their own serious medical condition or to act as a caregiver. How you use that leave is actually pretty flexible. So you can use the FMLA as one big 12-week block, or you can divide it into smaller segments of time. So maybe you need a couple weeks off for surgery and recovery, and then when you start weekly doctor's appointments and you need to take 1 day off per week for that, or maybe you just need to take 4 hours off in the morning for your physical therapy appointment. So how you actually use your FMLA time can be very flexible. You can also use it intermittently, which means that you might not know what days you're going to need it, but on a day that you're not feeling very well and you call in sick for work, you can use that as FMLA time so that you get access to that job and health insurance protection. Now, the downside to FMLA leave is that it is unpaid, and many people cannot afford to take FMLA leave because then they would have no income. And that's where disability insurance can come in, which we'll talk about in a little bit. But really, the major benefit of the FMLA is that it puts you in what we call the FMLA bubble. And when you're in this bubble, you're protected, your job is protected, and your health insurance is protected. So when we say that the FMLA leave is job protected, it means that an employee can't be let go for taking the leave. There are also return to work rights, meaning that when an employee returns from leave, generally, the employee must be reinstated into the same position or an equivalent position from what they had when they took time off. Job protection under the FMLA is important because generally, when you're taking time off using sick time or vacation time or even disability insurance benefits, your job is not protected in the same way that it is under the FMLA. California is an at-will employment state, which means that your employer can let you go for any non-discriminatory reason. So if you're taking your leave as vacation time or sick time, your employer can still let you go. But ultimately, your employer isn't allowed to retaliate or discriminate against you because you decided to take FMLA leave. FMLA leave is also health insurance protected. So if the employer pays for a portion or all of your health insurance coverage, then they would have to continue to do that while you are out on FMLA leave. So under the FMLA, you can get 12 weeks of leave per 12-month period. When the 12-month period begins and ends is up to your employer. So your employer can pick any fixed 12-month period of time to use as the year period for FMLA. But the employer does have to apply it in the same way to all employees. Knowing what your year period is can be helpful for figuring out when 1 year period ends and the next one begins, meaning when you have access to another 12 weeks of leave. There's also a notice requirement if you want to use the FMLA. So for leave that you know about ahead of time, you're supposed to give your employer 30 days notice. So for example, if you're going to have hip surgery in March, you are supposed to give your employer 30 days notice. But most of the time, the need for leave is unexpected. And in those situations, you're supposed to let your employer know as soon as practicable, which basically comes out to 1 or 2 business days, which really just means you should be letting your employer know as soon as you need to take FMLA leave. Your employer cannot require you to use vacation time or sick time or PTO time before you can access the FMLA. General paid time off does not come with job protection. So saying that you have to use that first before you get the job protection is actually interfering with somebody's access to the FMLA. And employers aren't allowed to do that. So if someone is eligible for FMLA leave, an employer cannot deny them that FMLA leave. Your employer is allowed to require you to substitute the unpaid leave under the FMLA with any paid leave that you have accrued, which means that when you're taking your FMLA leave, which provides the job protection and the health insurance protection, and then you at the same time would take either sick time, vacation time, or PTO so that you're getting paid while you're getting that job and health protected leave under the FMLA. But if your employer does not require you to do that, but you want to do that, your employer has to provide that to you. So there is some benefit to taking your FMLA leave and paid leave at the same time, because again, you're getting that job and health insurance protection with the FMLA, but then you're also getting paid through that accrued leave. Now, this is also a place where we can start to see the laws work together. So the ADA and the FMLA can work together. If you've used up your FMLA leave and you're not able to go back to work, you might be able to ask for additional time off as a reasonable accommodation under the ADA or California State Fair Employment Law. Typically, if you're asking for additional time off as a reasonable accommodation, it has to be for a set period of time. It can't be open-ended. So if you call up your employer and say, I know I've used up my family leave, but I have no idea when I can come back to work, but I'd like that time off as a reasonable accommodation, that's probably not going to be seen as a reasonable accommodation. But if you call up your employer and say, I know I have no FMLA leave left, but my physicians released me to come back to work after 4 more weeks, and I'd like those additional 4 weeks off as a reasonable accommodation, that could potentially be a reasonable accommodation. So the ADA can work with the FMLA, but it can also sometimes be used instead of the FMLA. Why might you want to do that? There are a number of reasons. It might be that your employer is too small and you don't qualify for the FMLA, or maybe you haven't worked for that employer for a long enough period of time, or you haven't completed enough hours. These are all situations where you might not have access to the FMLA, but you might be able to take leave under the ADA instead. California also has its own Family and Medical Leave Act called the California Family Rights Act. And the key difference between the California law and the FMLA is that it applies to employers with 5 or more employees, and it has an expanded definition of family. So it includes more people that you're related to or that you have that close relationship with under the definition of family. So if someone's unable to access the federal FMLA, they might still be able to access leave under the state law. California also has paid leave laws, including the Healthy Workplaces, Healthy Family Acts, that lays out the baseline numbers for how employees should be accruing paid sick leave. And in the city of Los Angeles, the city has its own law that is more protective than the state law and requires employers to provide employees with more paid sick leave. Caregivers can also get paid leave in California. So paid family leave applies to employees who have paid into the system and self-employed people who have opted in. And it can provide up to 8 weeks of leave per 12-month period and can be used to care for a variety of family members. I do want to note that you would only receive about 60 to 70% of your wages while on paid family leave. You would not get 100% of your pay. And before we move on from employment, I do want to make a quick note about disclosure. Generally, you are not required to share any information about your medical condition with an employer. But if you want to use the ADA's discrimination protections or access reasonable accommodations or access medical leave, you might need to disclose some information about your medical condition. But that does not mean that you need to disclose your exact diagnosis if you do not want to. Your need for leave or an accommodation may be based on a side effect that you're experiencing. And maybe you could talk about those side effects without tying them back to your original diagnosis, if you're concerned about disclosing your diagnosis at work. Now, if you have further questions, we have extensive resources about employment on our website that you can take a look at. That includes quick guides as well as animated videos, and on Triage Cancer, we have recorded webinars as well. If you're unable to work and you need to make up some lost wages, you may consider disability insurance. Disability insurance is one of those types of insurances that people rarely buy ahead of time, like you might with health insurance or even vision or dental care. But a 20-year-old has a 1 in 4 chance of actually needing disability insurance coverage before retirement age. And what disability insurance does is it makes up for those lost wages when someone needs to take time off of work because of their medical condition. But disability insurance rarely pays 100% of what someone was making when they were working. It usually falls somewhere between 45 and 90% of what they were making while they were working. There are a number of different types of disability insurance coverage. There is private disability insurance that can be bought directly from the insurance company, or you might be able to access it as an employee benefit from your employer. We've seen a lot where someone doesn't think that they have access to disability insurance from their work, but when they go back and they look at their employee manual, they find out that they do. It might be because they just signed a piece of paper on their first day of work and their employer paid the premium, so they forgot all about it. So we recommend people double check to see if they have access to disability insurance at work, because it might be very helpful to you. Now, these plans can be short-term or long-term. Short-term disability plans typically last up to a year, whereas long-term disability plans typically last a year or longer. California is one of a handful of states where they have a state disability insurance program. So to be eligible, you must have paid at least $300 into the state disability system. And then there's a 7-day waiting period before benefits can begin. So how this works is, for example, if you were to leave work today, January 29th, your state disability benefits would not begin until next Monday, February 5th, because of that 7-day waiting period. But you may be able to get up to 1 year of state disability insurance benefits to help you cover the lost income from being unable to work. And then finally, there are 2 federal disability insurance programs. Both are run by the Social Security Administration. These are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. These are both long-term programs, and they have a very high standard of what is considered a disability. SSDI eligibility is based on someone having worked and paid into the Social Security system for a long enough period of time. And SSI eligibility is based on having low income and low resources. If you want more information about disability insurance, we have a number of resources available on our website. Now, how can we put these ideas together? We're going to look at Jane as an example. So Jane's doctor has suggested that she consider going out on disability, but Jane has 3 weeks of vacation, 3 weeks of sick time. Her employer is covered by the FMLA, and her employer offers a short-term disability policy that can last up to 12 months. So what are Jane's options? So if she needs 12 weeks of leave, she could use the FMLA so that that time off is job protected as well as health insurance protected. And then instead of immediately starting her short-term disability, Jane might choose to use her 3 weeks of sick time and her 3 weeks of vacation time because she's going to get paid 100% of her wages for both her sick time and her vacation time. And then she can use her short-term disability benefits where she'll likely get a lower rate for the remaining weeks that she needs. So this is an example where every single one of these things is a separate benefit or protection that someone could use by itself. But this is what it looks like when we start to put the pieces together so that someone could tap into all of the benefits at the same time for the greatest level of protection and the greatest wage replacement options. Now, here we have Mark, who has the same benefits, but he's going to need 15 weeks out of work. So again, he can take that 3 weeks of vacation and 3 weeks of sick time to get 100% of his pay. And then he could use 9 weeks of short-term disability benefits to continue to get an income. And then what are his options to keep his job? Well, he can take the 12 weeks of FMLA for job and health insurance protection, but that still leaves 3 weeks. And for that 3 weeks, he could ask for time off as a reasonable accommodation under the ADA or a state fair employment law. Now, there may come a time where you need to leave work entirely. And one of the things that you'll need to consider is how that may impact your health insurance if you get your health insurance through your employer. So COBRA is the federal law that allows eligible employees to keep the exact same policy that they had when they were employed. So COBRA applies to employers with 20 or more employees and local and state governments of any size. So if someone is an employee of the federal government, they may have rights under a different law. The upside to COBRA is that, as I mentioned, it is the exact same plan that you had from your employer. So you don't need to worry about finding a new plan that covers the same providers that you had or covers the prescription medications you may need. Also, everything that you've paid towards your deductible or out-of-pocket maximum continues through the year like it would have if you were still employed. The downside is that it can be very, very expensive because under COBRA, an employee is now responsible for 100% of the premiums plus a 2% administrative fee. So those premiums can be very, very high. California has their own COBRA law called CalCOBRA, and it works a lot like the federal law because it allows eligible employees to keep the same insurance that they had through their employer. But one of the big differences is that CalCOBRA covers employers with 2 or more employees so that someone who may not be eligible for federal COBRA because their employer is too small may be eligible for CalCOBRA. CalCOBRA also can provide coverage for a longer period of time. So generally, federal COBRA lasts for 18 months for someone who has left work, and CalCOBRA can provide up to 36 months of coverage. So if we have someone who originally had federal COBRA, they used up that full 18 months of federal COBRA, they may be able to get an extra 18 months from CalCobra to get a total of 36 months of coverage. I do want to note that CalCobra does not apply to employees with self-funded plans. So what does that mean? There are funded plans and there are self-funded plans. Funded plans are when the employer pays a portion of the premium and the employee pays a portion of the premium. And then that money goes to a health insurance company, and that health insurance company provides health insurance coverage to the employee. Self-funded plans are when the employer pays directly for the employee's healthcare costs instead of using a health insurance company. So if you're not sure what type of plan you have, you can call the number on the back of your insurance card to ask, or you could talk to the person at your job that handles employee benefits. Now, COBRA is not your only option after leaving work. You may also choose to pick up a marketplace plan. Now, marketplace plans are plans sold by the insurance company, and California runs their own marketplace called Covered CA. So you can go to coveredca.gov. You'll enter some basic information about the year you're looking for coverage, your household size, income level, age, and zip code. And then the system will show you which plans you have the option of buying and how much financial assistance you might be eligible for. Now, Covered California uses the same application for marketplace plans and Medi-Cal, the state Medicaid program. So when you fill out an application, you'll find out whether you qualify for Medi-Cal or a marketplace plan with financial assistance or just a marketplace plan. In the past, there was very specific criteria that someone needed to meet in order to be eligible for Medi-Cal. But California recently changed the law. So in California, eligibility for Medi-Cal now primarily depends on income. So for adults, you may be eligible for Medi-Cal if you have an income at or below 138% of the federal poverty level. So what this all boils down to is that when someone is losing employer-sponsored health insurance, they have several options. That first option is going to be to select COBRA or CalCobra. And that, remember, is the exact same plan that you had when you were with your employer. The second lane would be to choose a totally new plan through the marketplace under a special enrollment period. The third lane is that maybe you're eligible for another group plan, like going on your spouse's plan from their work, or if you're under the age of 26, you might be able to go onto a parent's plan. But you would want to make sure that the plan that you're trying to get has a special enrollment period that you would qualify for, but most of them do. And then finally, based on the circumstances, someone may now be eligible for Medicaid or Medicare. So the trick with all of this is that someone needs to look at all of their options and pick a lane, because you don't get to change lanes until the next open enrollment period, which typically doesn't happen until each fall. And this is where we see it happen most often, is that someone is leaving their job for example, for a cancer treatment, and they get handed paperwork as they're walking out the door to elect COBRA. So they elect COBRA because, of course, they need health insurance. And then they're 3 months in and they're thinking, oh my gosh, this is so expensive. Can I get a marketplace plan instead? And the answer is no. Because you've chosen to drive in lane 1, you will continue in that lane until the next open enrollment period. When open enrollment comes around, at that point, you would be able to change plans. So to summarize our key messages for today, it's important to understand your rights to take time off and to work through treatment, which can include employer policies, state laws, FMLA, and the ADA. You may be able to access reasonable accommodations at work in order to do your job, and you may be able to get disability insurance to replace lost income if you need to take time off of work. All of the benefits and rights that we've talked about may also be able to be used together for the most protection and benefits. And lastly, if you lose your health insurance from your employer, you have several different options of where you can go to get your insurance going forward. Now, that ends the substantive portion of our webinar today. We ask that you please join us for the next session exactly a week from today on February 5th at 12 p.m. Pacific, where we'll talk about getting organized. I do also want to let you know about some of the upcoming webinars that we have through Triage Health. We actually have one coming up tomorrow on January 30th on health insurance that you can register for on our website, triagehealth.org/webinars. And on that website, you can also register for any of our upcoming webinars as well, in addition to tomorrow's. And lastly, I do want to mention our legal and financial navigation program through Triage Cancer. So through this program, you can fill out an intake form on our website and have a free one-on-one call with one of our staff attorneys. On this call, you'll be able to ask questions specific to your situation, and that staff attorney can help explain what options may be available to you and talk to you about possible next steps.